I'm joined now by Matthew Bush, one of the speakers at CI 2016. Now, from what I understand, you're all about access for cochlear implant recipients. Can you talk a bit about that?
So I practice in the state of Kentucky. I work at the University of Kentucky, and Kentucky is a rather large rural state. So we have lots of patients that live in areas that are far away from our medical center. And so we're working very diligently in the clinic as well as in our research to identify where these gaps and barriers are and try to remove those and try to expedite the time that patients can access care.
So I imagine the amount of support that a patient gets is directly related to how quickly they are kind of up and running again.
Yeah, it's true. There's a lot of factors that go into how a patient rehabilitates and certainly how they get access to care. Originally, certainly there's lots of research data that shows that the families, their educational level, and their socioeconomic status can play a major role in the timing that they receive access to hearing health care, such as hearing aids, and certainly with cochlear implants as well.
So what kind of things are being done to overcome these challenges?
Well, this problem is not just a single factor. There's multiple factors involved. So it really takes a large effort to try to coordinate multiple things at once, from satellite clinics to working with people in the community that may have hearing aid practices or otolaryngologists that may be in the community. But I think one of the most exciting things, it's not brand new, but we still haven't really figured out how telemedicine fits into cochlear implant candidacy evaluations as well as cochlear implant programming and rehabilitation. And I think that that's really a great opportunity for a rural state like Kentucky as well as many other places like Kentucky.
How important is CI 2016 for someone like you to collaborate with other researchers and talk to people in your industry to really get to the bottom of some of these findings?
Well, this is really one of the most important events that occur in my calendar year because it enables me not only to have fun and fellowship with friends and catch up, but it also enables us to talk about our research, to talk about our challenges within research, as well as the patient care issues that we are dealing with. And sometimes that develops new multi-institutional research initiatives based on some of those complicated problems, such as rural access to care.
Wow, well, thank you for taking a complicated subject and breaking it down for us, and best of luck in the coming days.
Great.
Thank you so much for joining us.
My pleasure.